Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to our Facebook Live event tonight. I hope everybody had a great Memorial Day weekend, and as you can see, we had a lot of sun this weekend. A lot of people are out biking, running at the pool. So we thought this would be a great time to readdress sun protection. And here with me tonight is Dr. Alicia Telega from the Shadyside Eye Associates. We did this last year and we thought this would be a perfect time to bring it back. It's mid-spring. We're going into summer, so we have months and months of sunlight ahead of us. So we're going to talk about sun protection, not only of our skin, but of our eyes. And we're also going to raffle off a sun protection formula. So all you need to do is type in a comment, and that will enroll you into the drawing. And these lovely ladies off camera here will choose the winner by tomorrow morning. So with that, welcome back, Dr. Telega.
Thank you. I'm so happy to be back. And sun care of the skin, and especially the eyes, is one of my big passions. Every patient that comes in, I always remind them before they leave, don't forget to wear your sunglasses. So it's something I talk to everybody about, because I think it is really, really important. And I'm gonna have somebody comment for me so I can get in the raffle too. I always love a good sunscreen.
Yeah, so please type in any questions that you have. We're happy to answer any questions and talk about this tonight. It's extremely important, both for skin and the eyes. People, I think, forget about how sensitive your eyes are. You do have moles or pigmented lesions in your eyes. You can get skin cancers, melanoma in the eye, so it can be devastating and deadly. So let's talk about that tonight. And I'm wearing some brand new glasses. So yeah, it was my first pair in about 5 years, and Dr. Telega set me up on it. So hope everybody likes them. All right.
Wonderful. Just to comment on that, you just said, I had 2 patients last week that have had lid melanoma removed, and just they come in now every year. We do pictures. We make sure that there are no changes. But it's a real thing that people don't realize sometimes, that those eyelids a lot of times go unprotected unless you have your sunglasses on, and that's really a place where things can be missed, and just really want to make sure you protect it.
Right.
So you don't end up with, once you remove those lids, you lose the eyelashes, you have asymmetry, lid globe, which is where the lid is in contact with the globe, which then can lead to dry eye because things aren't sitting where they're supposed to, and you have some exposure.
Right. So. Yeah, and it depends on the upper lid or the lower lid. I mean, sometimes some of us, as we get older, are graced with some extra skin in our upper eyelids, so we can resect that and maybe not too much of a problem. But if you don't, I mean, when you resect that skin, you may not be able to close your eye, and you may end up having to have a skin graft. I know from my burn background, when skin grafting eyelids, because it burns, don't work very well, because the skin graft has to be very thin. It turns into more of a scar tissue. The lower eyelid, as you're talking about, you can pull down and actually give you something called an ectropion, which is your eye pulling away from the globe, which can be a serious problem. As you said, you can lead to dry eyes, and again, you can get scarring of your cornea and lead to blindness. So these are all bad things. Some of you that know, my father died of melanoma that started in his right eye. So it's near and dear to me. And so let's talk about it tonight. So any of the comments that you have or any questions, please feel free to type them in.
So would you say it's safe to put sunscreen around the eyes, or how do you protect the eyes?
Well, that's a good question, because what I recommend to patients with a very light touch, doing around here, where you put your eye cream and then along the upper brow, but you can't get too close to the eye. Those sunscreens will kind of melt in toward the eye, and then you get those chemicals in the eye, and it's going to burn, cause a corneal toxicity or keratitis, which is inflammation of the cornea, which can cause some blurry or foggy vision, and basically it would just be miserable. So that's where I like to then recommend, once you do your sunscreen around the eye, or your sunglasses, or hats too, or both sometimes, to protect the actual thin skin of the upper lid and that lid margin from the sun, as well as the eyeball itself, because you can't rub sunscreen on the eyeball itself anyways. You got to go to the sunglasses. You need them regardless.
Right, and I think one of the biggest mistakes with sunscreen is, people, especially around water, people are out on boats or at the beach, they're in pools. A lot of people I saw yesterday around the pool had hats on, no glasses, so they don't realize that the sun reflects off the water and comes up underneath the hat, the brim of the hat, and so you're getting just as much sun, and you don't realize why you're burning, so you still have to have the glasses on.
That's important in skiing too. Get that a
Exactly,
lot
even
from
in that
water,
ultraviolet
sun.
light, yeah, you can get burning. We always think it when you're skiing, you always think it's the wind. It's really not. A lot of it can be, you get some chafing from the wind, but a lot of it's the ultraviolet light coming through the cloud barrier and reflecting right up onto your face.
Do the sunglasses that you wear have to have UV protection in them to protect you from the sun?
Yes.
I know in our last conversation, the last time we had this, you talked a lot about pediatric wearing sunglasses that you buy in in the drugstore or the kids stores that you think protect your children, but not necessarily.
I recommend getting them from a reputable source. They don't have to be the most expensive, but you need to make sure that wherever you're getting your sunglasses from, they do have 100% UV protection or UV blocking. I told a story last year. And my nieces were at the Disney store, and there were play sunglasses without even lenses in them that were tagged as 100% UV protection. And I was like, oh my goodness, people may believe something like that. So always get them from a reputable source, and always look for 100% UV protection. If you don't know if your sunglasses have good UV protection or not, in my office and probably most eye doctors' offices, we have little machines. We can put your sunglasses on, and it'll tell us how much of that UV is being blocked. So we have those sort of machines, and most opticals would have those. If you're not sure and you spend a lot of money, you just want to check it out, we'll be happy to measure those for you. I get a lot of questions too about something called polarization. You don't necessarily need that to block more UV. What that does on a lens is block kind of like glare and halos, and especially if you're doing a lot of water sports, fishing, you don't get as much kind of glare, so you can see better through the water, things like that. But that's not necessarily important in UV protection. It's just more of like a bells and whistles kind of thing. So it just makes sunglasses more comfortable to wear, especially for certain activities. So always get them from a reputable source. If you're not sure, have your eye doctor measure them to make sure, because otherwise, if they're just dark tinted plastic, behind that lens the pupil can get bigger, then you let more of that harmful UV in and potentially cause more damage when you think you're doing a good job for yourself.
Does the size of the lens, the size of your sunglasses matter?
I think so, because if you get those little tiny ones, from the 90s that are kind of making a comeback, which I think are cool, but if part of your face is exposed and you want that protection for your, wrinkles and to protect the lids like we were talking about in the beginning, then a little bigger frame certainly is a little bit better, I think, better coverage.
Does squinting in the sun just affect wrinkling around the eyes, or can it affect other parts of the face?
I think number one, you get headaches from it, but I think that we all squint at some times. I think a lot of times that you can start not only getting lines around the eyes and around the crow's feet area, but in the brow area that we treat with the number 11s for Botox, because you're scrunching down on the corrugator muscles between the eyebrows. And so I think that you can lead to more aging of your face, especially if you're out in the sun that much. Now you're getting people that are probably squinting and not wearing sun protection probably aren't using sun protection for their skin either. So now you're getting the dermal damage or the skin damage from the ultraviolet light. So you're getting an aging process along with that. So you're probably getting some premature aging for the entire part of your face and down onto your neck.
What is the recommended amount of SPF sunscreen should have when you're using it, just not only on your face but on your body?
That's, again, it's sort of just like, what does it mean to be polarized and also protection from sunglasses? SPF is a big, I think, misunderstood abbreviation. SPF stands for sun protection factor. The numbers after that, SPF 10, 15, 30, 50, 100, everybody thinks that if you do an SPF of 100, it's better than 50, is better than 30. What that really means is the studies show that when you're out in the sun without any protection, most skin types will start burning after 15 minutes. So an SPF of 10 gives you 10 times the amount of time before you start to burn. So that would be, instead of 15 minutes, it'd be 150 minutes. So it actually just gives you that amount of time. SPF 30 gives you 30 times 15, or 450 minutes. So, but that doesn't mean you can go 450 minutes before you reapply it. So basically, the rule of thumb is I wouldn't use anything less than an SPF of 30. SPF of 30 will block 93% of the sun's rays, both ultraviolet, UVA and UVB. And make sure it says that on the bottle as well. It'll protect against both, because both can cause cancer, both cause aging of the skin and damage to the skin. So SPF of 15 is 93%, SPF of 30 is around 97%, SPF 50 and above goes up to about 98%, and SPF of 100 is only 99%. So you're only getting another couple of percentage points, but you're getting more chemicals. And so sometimes, especially with little kids, parents will slather them up with SPF 50 to 100, and actually their skin is more sensitive, so they might get rashes or some irritation from those formulas. So I would say really about an SPF of 30 is really where you want to start. Again, you're getting enough sunlight if you want to get a little bit of a tan, but you're blocking out most of the rays. That also needs to be reapplied about every 2 hours, or even sooner than that if you're swimming and sweating, but every 2 hours to keep that coating on there. The other thing is you have to put it on in plenty of time. People don't realize that it takes about 20 minutes for whatever sun protection formula that you're using. It takes about 20 minutes for the barrier to be set up. And again, I just told you, if it takes 20 minutes for the barrier to be set up, but in most skin types you're already burning at 15 minutes, how many times have you said, I use sunscreen, I'm still getting burned? It's probably because you put the sunscreen on whenever you got to where you're going to be exposed to the sun. It's already too late. So you've already done the sun damage. So you want to put it on before you get to where you want to be by at least 20 minutes, and then you should be protected.
Oh,
Would
such
you-
a good point.
Would you recommend putting sunscreen on even if you have the hat and the, they have all the long sleeve gear now for being outside? Do you recommend they still use sunscreen?
I think if you're really using the sun protection gear, the shirts and the shorts and everything else, I think for most skin types they're actually pretty effective. I think if it's going to be on your child, I think you take every protection that you can, and you still use the sunscreen. I think most of the time people will use a hat and think that the hat's going to block those rays, like we just talked about. If you're around water, even a reflection, if you're out, a lot of people are out golfing, and just reflections off of the pavement, reflections off the water. You think, I've got a hat on, I'm protected, but again, you're getting that rebound, and so I think you still need to use it.
Amy asks, what are your recommended face products for daily use?
We use a Topics formula and also a Skin Medica formula. So we have two different lines. Both of them are excellent products. And what I usually do is have patients come in and talk to Tara, our esthetician, about what might be best for your skin type, your skin tone, and really at what age you are, your elastic properties. So I would recommend seeing Tara, but we do have two lines that are actually excellent on both sides.
Catherine wants to know, do you recommend a cream versus a lotion versus a spray sunscreen?
I don't think it really matters. I think the biggest thing is using enough of it, and because the amount of sunscreen that you use is just as important as using it in a timely fashion. So you really do, it's just spraying a little bit on and going is probably not enough. You've got to have a pretty good layer on, even when you spray it, that you sort of have to rub it in. So you have to remember, if you've got a spray can or a jar or a bottle of sunscreen and it lasts you all summer, you probably weren't using enough.
Jonah asks, is there a responsible way to indoor tan in a salon while minimizing the damage to eyes and skin? For example, using a high-quality skincare tanning lotion, minimizing exposure to one time a week for a few minutes, moisturizing and tan extenders?
Well, for the eye, I've heard some people going in there without the little goggles on, and I just, I can't lecture hard enough. Do not do that. But as far as the skin, I mean, I don't know that any exposure there is great.
I think,
but
especially when people are using tanning beds, which I abhor, but even when you close your eyes, remember your eyelids are only a few millimeters thick.
Exactly,
They're not going to give you any type of protection as those rays come through. I wouldn't encourage anybody to use a tanning bed in any sense, either at home or in a salon. The studies are predominant. They show that even in those cases, the skin cancer rates are enormously high. Most of the time, we're quoting rates of about 1 in 100 of us out in the generalized sunlight developing melanoma now. That's really on the rise. About 20 years ago, it was maybe 1 in a couple hundred. So it's rising rapidly. Studies show if you use a tanning bed multiple times a year, even just once a month, your risk can even go up to 1 in 15. So I would tell you it's not safe. As far as the spray tans go, or the chemicals, so far they've been shown to be not harmful, but I can tell you that there are a lot of studies being done right now, because some of the spray tans, I gotta tell you, are really natural. They look fantastic. They do very well, especially around prom and this time of season where everybody's, it's wedding season. So just be aware that there hasn't been, as far as I know, since even last year, that I've not seen anything coming out about any danger with them. So I think that right now they're probably pretty safe.
There's a study going on I just read about this morning that they're launching right now through the summer, and then they'll have the reports on sunscreen in general for, there's no one really monitoring it as far as
like with the chemicals and
yeah,
stuff in
and
it.
how the chemicals are affecting the skin, how much absorption.
Yeah.
So
Right.
I think in the fall of 2019, they're saying the report should come out.
There's a lot, and even just our regular cosmetics we're using every day that's unregulated. So I'm hoping there's going to be more and more studies and possible laws coming into effect to protect from what we think we're doing healthy for ourselves, and then end up with more chemical exposure. So.
Right. That's one of the questions I always ask, or I get asked, is patients want to know, what skin care lines I recommend.
I got asked that twice today, even.
Yeah, I think you have to stay with some of the bigger name brands. Neutrogena does a good job. They make some great sun care or sun protection formulas. They've been around a long time. So I think, again, I have to wait and see what this report shows. But I think, again, even with some of the most common ones, I think if you use enough of it and in enough time, it should be enough, especially if you stay in that SPF 30 range, because again, you don't have as much chemicals in it, and they've been shown to be pretty good in the past. So I'd be interested to see the results of that.
Yeah, definitely.
I have a question. So I think you answered it, but I wanted to ask it anyways. So every year when vacation season comes around, I hear everyone saying, like, I'm going to get my base tan because it's going to protect me from sunburn, which is ultimately the worst. Is that a myth?
Yes, it's a myth. The base tans really do not exist. In fact, I never heard that term until we moved to Pennsylvania.
And you lived in California.
Right, and so we always had a
Where there
base
was
tan,
actual
I guess.
sun, yeah.
So, but here, there's really no rhyme or reason behind that. The studies on that have shown an SPF of 4 is what a base tan protects you at, which is basically nothing. So, listen, we all like to be tan. Everybody looks, we all like the way we look with a tan. It feels good to get some sunlight, and so everything in moderation. But there's really no reason. It's sort of a justification to be able to use a tanning bed. I would tell you, just stay away from it. It's better to go out with an SPF of 30 and allow some of the ultraviolet light. It may take you longer, but you're getting a less concentrated dose. Remember, in a tanning bed, you're getting an enormous amount of ultraviolet light in a very short period of time. So you just revved everything up much stronger than you would just going out and getting natural sunlight. So I just wouldn't recommend it.
Is it possible to reverse the sun damage to the eyes? We talked about that a little bit earlier.
No, not that I know of, unless you're going to visit Dr. Antimarino to help with the lines from squinting that we talked about, and then other issues that UV light causes inside the eye, or other age-related changes like cataracts, which are not reversible. Once those are advanced enough that they're affecting vision, the only way to correct that would then to be to have cataract surgery. And then further back in the eye, macular degeneration, which we all know is an age-related change to the inside of the eye, our area of central vision. And once those changes are there, they are not reversible, and they may only progress over time, leading to vision changes, as well as what we talked about with lid lesions, or there's also something called a pinguecula, which can form on the white part of our eye. They're not dangerous per se, but they're very cosmetically unappealing. And those are non-reversible. So no, there's no way to reverse the changes, the UV changes to the surface of the eye or inside the eye once they're there. So protection and prevention is what I always stress to everybody. It's really hard to go back in time. You can't unburn paper. You gotta try to protect those changes from happening.
How often would you recommend a patient have their eyes checked? Is that someone that's not really having any visual problems, should they be coming in?
Yeah, just once a year is what I typically recommend for somebody who's just getting a routine evaluation. But then if you do have issues, for example, a history of melanoma, depending on what your diagnosis and your health history and other factors, we may want to dilate you twice a year or see you more often. If there's a lid lesion that I think is suspicious, I might have pictures done, a lot more frequently than once a year. But typically, anybody, I would recommend yearly exams. With the dilation, that's important.
Jonah wants to know, as a teen, I tanned extensively without eye protection. Now I have a hard time seeing at night, especially while driving. Is that directly related to sun exposure without eye protection, or just aging?
Well,
How old is Jonah?
I don't know.
Yeah, if
it's hard to answer that.
It is hard to answer that one a little bit, but yeah, if UV light, as we know, can cause age-related changes in the eye, like cataracts. Cataracts are kind of a yellowing of the natural lens of the eye. So
He's
when
not saying how old he is. He
when light enters the eye, that scatters light, causes a lot of glare and halos around headlights, especially if it's wet. You're going to get a lot of reflections. So the first thing that comes to mind when somebody's mentioning they've had a lot of UV exposure and they're having trouble driving at night, and I don't know their age, I would think maybe cataracts if they're old enough. If not, then I start thinking about some surface stuff from being in the tanning bed more recently, and this, keratitis or something.
Now, is that something he could come in and be evaluated for?
Yeah, absolutely.
Okay.
Absolutely.
So Jonah, come in and get evaluated.
Yeah, and the eye
And we're
exams are a lot
somewhere.
easier nowadays.
Yeah.
You have some great equipment over there, so
Yeah.
it's not like the puff of air anymore. It's
No,
a lot
people
more
hate-
gentle. And
The people hate the puff. I myself hate the puff. I know it's coming, and I
Yeah.
still, jump back every time. So we don't do the puff of air. We do photographs. I love doing, showing people, hey, look, this is what you have, education. So I feel like once they see those things in detail, it's just easier to follow through with your sun protection or whatever we decide.
yeah, and I think honestly, I'd recommend it because it's eye-opening, no pun intended, but because it does show you how fragile your eye is, and so the skin is pretty fragile, but we can resurface it. We can do different things with the skin. We can certainly excise things and treat it with lasers and stuff. You can't do that with the eye. There's no extra tissue. There's nothing to borrow from to pull in from one area to another. You can't excise things on the eye, the retina or anything else. So and it really is your most precious gift. So you can't stress enough to.
And that's why every patient leaves, I give them the same advice. Make sure you wear your UV protection to help prevent age-related changes, just like you put sunscreen on or your sunglasses. And that's a message I give everybody when they leave. It's so much easier to prevent and protect rather than try to, like you said, fix a problem after it's started.
What are your thoughts on vitamins for eyes, for vision, things like that?
Well, that's a good question. I get asked that a lot. And in addition to talking about UV protection, when a patient is about to leave my office, I also tell them don't forget about good nutrition. Poor nutrition ages the body and ages the eye. So I always recommend good green leafy veggies in your diet. If you don't get that in, then I recommend a multivitamin. There are some eye vitamins out there, specifically something called the AREDS formula, which stands for Age-Related Eye Disease Formula, AREDS, and that was a study that was done that showed if you have macular degeneration, these vitamins and minerals in certain concentrations can have a protective function over the macula. And those vitamins were ACE, zinc, copper, lutein, and zeaxanthin. But AREDS 2 came out and said if you take that formula and you do not have macular degeneration and then develop macular degeneration, then the formula won't work for you.
I was going to ask you, why don't we all take it?
So, that's a lot there. We're going to slow that down. I'm going to try to get that all out one time. So I always recommend do not take that formula unless you're diagnosed with macular degeneration. Otherwise, it won't work as well for you. So I recommend I extrapolate from that study, both of those studies, and say, hey, if these vitamins are protective once, or vitamins and minerals are protective once you have the problem, then it makes sense that they would help prevent the problem. So that's where I come in and say, instead of at those higher doses and those higher concentrations, get it from your food if possible, and if you don't like good green leafy veggies like I do, then do a multivitamin. And that should get that in the way that you need it. Yeah.
Jonah wants to know, what is macular degeneration? You've said it a few times, and I don't think everybody knows.
The macula is in the very back of the eye and the retina, and it is our area of central vision. So everything you see right in front of you, color, detail, faces, everything right here is controlled by a very specific, very specialized part of the retina called the macula. And because that area is so specialized, it's also incredibly fragile. So things that can age the body can cause an early degeneration of that part of the back of the eye, and that's smoking, UV, poor nutrition, and then you have other factors like, your genes and comorbid diseases. Because if your body's overall unhealthy, that can cause issues as well. So when that area degenerates, then you can have central vision loss. So it doesn't cause blindness per se, but it can cause a big central vision loss or spotty vision that can't be corrected with glasses, can't be corrected with surgery. So once that area ages or degenerates, there's really very little we can do other than try to stop it from getting worse, which sometimes isn't good enough. So I always want to protect that area very carefully.
When you have when you come in for an eye exam with you, do you look for like a skin cancer change maybe to the eyelid? You
absolutely.
would note that.
Yep, absolutely. If I see any lesion on the eye, even if it's just a little tiny, what looked like a regular freckle, I take photos because my memory is not good enough. My little drawings are not good enough. But a photo that I can take that year and bring it back to whatever appropriate amount of time, whether it's 3 months, 6 months, a year, whatever. Put those two photos side by side, and you know without a doubt if that changed or not.
Right.
Yeah.
You mentioned earlier about like cosmetics and SPF being in your cosmetics. I was wondering if I applied a serum or a night cream that had SPF, if it lasts me into the morning, or if I need to reapply something. If I apply makeup over something that has SPF, does it still work to protect my skin? Are there any eye serums that have SPF that I should be applying to protect that more fragile skin?
It's a great question, and so I think the makeup company has done a good job of putting, adding that into their formulas. But again, remember, it only lasts a certain amount of time. So this is the thing that, so if you put something on at night, you probably have to reapply it in the morning because it's just, you've gone all night with it. I don't know why they would have a night cream with an SPF in it, and you're not going to be sleeping outside in the sun. So, but it's in there, and if you can use that again during the day, then I would. Now, most makeup has SPF in it. So let's say you're putting on your makeup in the morning and you go to work, so you're in your car, you get out, you go into the office, and you've been in the office all day, you're not really exposed to any sunlight. But when you come out and you are, then you need to either reapply the makeup or you have to reapply a sunscreen on top of it. And so that's the thing that I try to get patients to understand. Like I said, it's a great thing that they're putting it in there, so you just put it on. And the nice thing about that is you're not putting it on, well, I hate to see when women are doing it and they're driving, but usually you put that on in the morning before you go outside, so that by the time you go out, the SPF barrier is kicked in. But again, you still have to reapply it, and about every 2 to 3 hours, if you're in an area with sunlight, you need to reapply it. So you have to remember that.
As a plastic surgeon, how do you treat aging around the eyes?
Well, there's, depending upon if you're just looking at the skin problems, sometimes it's really getting on a good skin regimen with Retin-A, sun protection, even some bleaching creams. Sometimes we get that hyperpigmentation. So treating the skin itself, getting really controlling that texture. There are other ways of treating it with a laser. So now you're taking off that outer layer, that sun damage, and really getting down to some better skin layers, and then starting over with that. Microneedling can help. That really helps with texture, sometimes with the pore sizes as we get older, and that changes. So these are a lot of the non-invasive ways. Sometimes, again, we talked about developing lines now, fine lines, crepey skin, crow's feet. So now you start getting into a little bit more invasive things. Botox to treat those crow's feet. You can use some different types of microneedling, which we'll talk about in a little bit, that can help with some of that crepey skin. And sometimes it's now you start turning into surgery to remove some of that crepey skin, especially under the eyes. We see it mostly in women because your skin is thinner to begin with. As you age, you've had not only sun damage, but changes in your hormones. So you get a lot of crepiness, and sometimes it's just actually an incision to take out that crepey skin. It's still what you leave behind is crepey, but there's less of it. So now you have to start treating that. You can do brow lifts and temporal lifts, and sometimes to rejuvenate that area. So it can run a gambit of skincare to minimally invasive to surgical correction.
Jonah commented, in DC, everyone gets Botox on some level. He had a friend whose injector used generic Botox.
A generic Botox? I wouldn't recommend that. There was when we were back in California, I was practicing there was a lot of patients that were getting Botox out of the country, down in Mexico. The problem with that, Jonah, is you don't know where it's coming from. It's a very strictly regulated product. It is pretty benign when it's done in the right way, manufactured in the right way. But when you have tendencies to stray from that, you don't know what's in it, now you're injecting that into your skin, the muscle, you're affecting the nerves. You can have a lot of problems, and they did. There was a run where there was a lot of problems using sort of knockoff botulinum toxins. So I would not recommend anything that, I love Amazon, everybody loves it, but if you're buying stuff off of Amazon, or you're going out of the country and you're buying it, you have no idea what you're getting. You really need to go through, just Dr. Telega said, getting it from a reputable dealer, or for your eyeglasses, you need to go to a licensed physician, preferably somebody who really oversees their spa, who is board certified, and so you can trust it, because we're all so very closely scrutinized and regulated.
That's a good thing.
You mentioned earlier when we were talking about wearing the sunglasses, is it difficult to get your prescription in the sunglasses?
No, not at all. Any optical, my office included, we'll, if you have a prescription you come in with, great, we can make sunglasses with that. Or, if you need a refraction or your regular exam, then we get those measurements. And then the optician, who's the person that measures the glasses, would take a look at your prescription and determine, maybe if you're a really, really high myope, you can't have those huge sunglasses because they would just be way too heavy. So you need an expert that's going to look at your prescription and say, oh, hey, we need to do something that's going to minimize some of that weight. You might need something a little smaller, or a certain type of high index style lenses. Backside anti-reflective coating, if you're not wearing hats, that sun's coming in from behind here too and reflecting back in. So a lot of really, really, cool things that we can do with lenses. But yeah, putting your prescription into a pair of sunglasses, even if you're the highest of high prescriptions, it can be done one way or another, for sure.
There's ways also, you have those, I was looking with Janine over at your office, They have those ones that they're almost magnetic. They just stick
Yeah,
right
those
on,
clip-on.
so you can. And,
I
and
know,
they look great.
everybody poo-poos clip-ons anymore, but I'm telling you, they're making a comeback and they're really cool,
Mhm.
like the ones that you saw. They're not like those old 80s style nerd ones that kind
Yeah.
of flip up like in the visor. No, they're really sleek, and then you just have your regular glasses and you throw those on over top. They, just takes one hand to do it. So I really like those. I think it helps people who maybe don't want to carry around 2 pairs of glasses all
Right.
the time, or maybe don't have the funds to do 2 pairs of full-on prescriptions. Like, this is expensive for some
Mhm.
people, depending on what you need. Those are really cool. So,
Yeah.
And I have fun just snapping them on and off all the time. So.
Are there any skincare products that you have in your like everyday routine that when you're going to go out in the sun that you should not use? I think it's my vitamin C serum. It says on there like pretty
Right.
big, like don't use this for sun.
A lot of that stuff you use at night. Retin A you want to use at night. Like you said, vitamin C you want to use at night because it sensitizes your skin, so you want to have that overnight, and so it's kind of worn off by the morning. So you have to be careful with that. Anybody who's using Accutane for acne really needs to be careful with sun protection. Also antibiotics. There's certain antibiotics that you take can also sensitize your skin that you can burn more easily and or pigment changes. So you have to be careful now that the sun is out. If anybody's getting a prescription from their doctor, or even ask the pharmacist. The pharmacists are a great resource for asking them about the medication that you're taking. Am I at risk for sunburn, sun damage because of that sort of sensitizing your skin?
I have another question. So, kind of like when you go out into the sun and you get sunburn, are there any symptoms that you could look for where you go out in the sun and maybe your eyes were damaged by the sun?
That's a great question.
The most immediate one I can think of is something called solar keratitis, which is, this happens a lot when people are on the water or skiing a lot. You get enough of that exposure that it kind of roughens up the front surface of the eye, which is the cornea, and then you'll have pain, burning, tearing, that kind of thing. There's something called solar retinopathy, which was a big scare when we had the solar eclipse. So was that last year or the year before?
I was going to ask about that.
The people went out and tried to peek at the eclipse without their protection on, and those are 2 immediate things that would happen. But most of the other stuff, just like skin damage, is, solar keratitis, that's like a sunburn for the cornea, by the way, so that would be kind of along that immediate line. So, but anything else, just like skin damage, it's going to take some time to show up, like cataracts, the pingvicula I mentioned, certainly anything with the retina. That's going to be over time, so that's why I always tell people, just like you put your sunscreen on to prevent those problems, wear your sunglasses, because it's cumulative over time, most of those problems, unless it's something acute.
I have one more question before we head out. I was wondering if both of you could talk a little bit about what signs you should look for when it comes to skin cancer, both on the skin, and then you mentioned like lesions on the eye, or if there's anything that you should look for based on the different types of skin cancer.
Okay.
Well, you'll be able to answer this probably a little better than I do, but I look for any lesions. There's that, that A, B, C, D, E, asymmetry, borders, all those things. But if you have anything on your eye, you probably aren't seeing it as well as like I would be able to look at something on my arm and really, get a good look at it. So you want to come in so I can look at it under the microscope or the slit lamp to get a really good look at where that is and where it's coming from. And then get photographs so we can watch them better over time. So for the eye, I really recommend serial photography to look at anything you might think is suspicious. And then sometimes if you're like, yeah, maybe that's a little too suspicious, we'll send you to somebody who may want to remove that and get it biopsied. Sometimes ophthalmology or plastics, or a specialty called oculoplastics, which sometimes really specializes in those lid lesions. So I think just having it looked at with the eye is my biggest recommendation.
You mentioned your father, but what did he notice on his eye? What was the...
He had a pigment on the cornea, on the sclera, the white part of the eye, and he had it for some time. Unfortunately, his ophthalmologist didn't really comment on it, so it was there for a while before he was sent over to, he was in California, so he was sent over to UCLA and looked at it there. So any pigment in the white part of your eye, that's sort of that's a nice giveaway because you shouldn't have it. Also, if you're looking down, I mean, it can happen on the inside, on the conjunctiva, the mucosa. When you pull your eye down, that red mucosa, you can get some pigment in there. So anywhere that you're seeing some pigment, you should have somebody take a look at it. Again, mapping, photographs to really watch it. Remember, we're talking about melanoma because that's the one that really is lethal in many cases. So, but there's squamous cell and basal cell cancer. Those still the most common. They do go way up in the sunlight, and also people that have tanned and tanning beds, Jonah, and you're at risk. But we all are. I mean, we grew up at a time where we didn't use a lot of sun protection. So what you're looking for there, what I tell patients is if you have a new area where it looks a little inflamed, it's a little red, sometimes it can look like a little patch of crusty skin or dry skin. If that goes away, fine. You put some moisturizer on. If it goes away, great. If it comes back and it's in the same spot, then it probably needs to be looked at. Other times you get a small sort of raised, crusty area that might bleed once in a while, and you think it might be like a little pimple or something, and then it goes away again. It's gone for a while, it comes back, it goes away and comes back. So most of the time that's a basal cell cancer, and many times. And I ask patients and they'll say, it's been going on like this for months, but it goes away. But if it's coming back in the same exact spot, it's most likely a skin cancer. So anything raised with sort of almost looks like a volcano, so it's kind of raised on the edges, and then it has a dip in the middle. Anything that you think is on your skin that's been there more than 2 to 3 weeks, you should be looked at. And because they're easy, these kind of skin cancers are more of an annoyance than anything to be really worried about. So they can be taken care of. So I would recommend seeing your dermatologist, have them look at it. Again, they do a lot of mapping as well. They do serial photography, just as we're talking about. So I would definitely point it out to somebody and just have them look at it. Also, look for places that are between your toes, under the nails. Moms with your kids, look on the scalps, look on, I can't tell you how many people have come to me because their hairdressers have found a mole or a dark pigmented lesion in their scalp line. So sometimes little kids will come in and they'll have that sort of this congenital nevus, so they've had it since birth, it's small. And a lot of times as they grow, it's growing. So a lot of times we take it off because there's no way they're going to be able to monitor that. And there is a small chance over the course of their life, even 4 or 5%, that those congenital nevi can turn into something as an atypical nevus or even melanoma. So it's best just to get rid of them. So they can pop up in any area, and these are areas that are just forgotten. Back of the neck, armpits, and the groin area. Ella's pointing behind her ear. So again, these are places that you don't normally look at in the mirror. So if you have kids or a spouse or a significant other, just take notice of these. As you were saying, I have patients that come to me for one thing, and as I'm examining those things, I'm always looking for skin things, always looking for moles or patches that may look, because they're real easy to pick up, and you want to get them before they can get out of hand.
So you mentioned in closing you wanted to bring up something about microneedling.
Yeah, so we are really proud to announce that we have just purchased a new device. It's a Vivace system, and it is a microneedling, which is all the rage, and we've had great success with it here, but this is now microneedling with radiofrequency. So now we can use radiofrequency to really target the dermis even more. We are the only practice in the Pittsburgh area and even out into Ohio with it. We've looked at it for a long time. We've demonstrated it here. We've tried it on some patients and our staff. They're always guinea pigs. So this is sort of a step up from microneedling. It is fantastic. It's for, again, texture, pore size, crepey skin. Again, we were talking about not only crepey skin under the eyes, you can get it right up onto the bone here. You can't get up onto the eyelid with it, but around the face, you can get it down on the arms, the neck, the décolleté area. So all you ladies that have sort of that sun damage on the skin, that crepey skin, this would work terrifically. You can use it on the legs, so it's really all over the body. We are going to start using it immediately, and we are going to have a demonstration in June, I believe.
Next slide, Facebook.
our next live Facebook. So we got something brand new to show you. Again, we're the only practice that they've come to. We've looked at it for several months with the company, and Ella and I are going to be going up to New York to meet with the CEO and some of their other administrators next month, and talk about where they're going with this product. So we're excited to show it off, and we hope that you'd be inquiring about it. Any questions that you have, please let us know at info@bellissimoplasticsurgery.com.
I have so many questions again. I know exactly
So
what I
yeah,
want.
listen, this is really exciting for us. So
That's really
we're
cool.
really happy, and
I want to
Well-
let you know, April said she loves Dr. Telega, and Kate says Dr. Telega is the best.
Oh, how
we
nice.
think so as well.
Those are unpaid people. I don't think I told anybody. So thank you, April and Kate. I appreciate that.
All right. Well, listen, thank you very much. If you want any more information, visit our website. Also follow us on Facebook, Twitter, and Instagram, right? And so we're looking forward to next month. Please tune in. Do we have a date on that yet? No date. We'll let you know, but we'll launch our Vivace device at that time. So again, thank you so much. Thank you to Dr. Telega,
thank you
and
for
I
having
can
me.
encourage you, come see her. She's wonderful. Janine in your office is terrific. She
Yes.
fits everybody
I
with
love
great
her.
glasses,
Mhm.
contacts, whatever you need.
Everything.
So,
We do it all there. So thank you. Thank you
All
so
right.
much.
sounds good. Thank you very much. Good night.
Bye.